Good morning, everyone. Welcome to Vaccine Equity Coalition monthly call. Jamal, if you can just keep letting people in. I still see some people in the waiting room. Okay. A big question everyone's been thinking about is, when's the end to this thing? So we're getting into this feeling of safety. The CDC, because of a federal judge's ruling, no longer have to wear masks on planes, which some people learned mid-flight. And we're reopening. We are going back to a normalcy. Is that a real normalcy, or are we lulling ourselves into a false sense of safety? And one of the topics we're going to talk about today is our survey from our funders from the previous year. We did commit to doing 2 surveys. We met with a couple of you and discussed some topics earlier this past month. We have the questions ready we wanted to share, and we'll do a roundtable just to get everyone's thoughts. Because we do have this opportunity to actually learn. Are we feeling safe? Do we feel like we're moving beyond this, or is there still risk out there? So just some general updates. We still are pursuing funding to continue the coalition through this year, potentially onwards. I will say it is being difficult because, again, there's a feeling of safety. We have communicated, and I've had conversations with many of you, that even though it feels safer, marginalized communities still are highly at risk, especially if you think about with what just happened at airports and on flights. I mean, a lot of people felt upset about that because they feel like they're at risk. And are we still actually in a place of safety? So we still have existing funding opportunities, 3 in total. At this point, I think last month they communicated an 80%, at least for California-based organizations, an 80% likelihood that some additional funding will be provided. I think it's kind of slipping back to 70, 60% in my mind. The case data and infection rates in the United States are going down. They're not showing upward trends, even though counterparts in Europe have seen that. And we are still doing really good work, which I'll get into. So existing new funding is probable, but not as of high certainty as before. And we will definitively know in the May-June timeframe. The second survey, which we'll talk about later, will be a big part of that, because it is essentially, you can think about it as a needs-based assessment of whether this work of this coalition needs to continue. And it's been some amazing work, and we'll talk about how we're still doing that. The National Geographic article, so to be able to deeply explore the plight of marginalized immigrants, we found a reporter that wanted to do a 4-part series on what that specific experience is like. And I introduced her to a few organizations. I haven't actually heard back. I know she's starting a budget analysis to do some in-person interviews. Has anyone on this call actually spoken to Priyanka directly, and any updates you could provide to the coalition on that opportunity? I don't know, Carla, I think I introduced her to you in April. Actually, could you just?
Yeah, I'll speak. So we did speak with Priyanka, and it was an exploratory conversation. And as we all sort of suspected might happen, it ends up being that our work is a little bit outside of the idea for this 3 or 4 story series that she's working on. But she learned a lot from the call and was saying that our work actually might constitute its own story later. So we left it as she was going to mull it over and get back to us. But it's most likely that VEED wouldn't be included in this particular series.
Yeah, and I remember that I spoke to her also about your work and just focusing on members of the community that are detained. And her focus was more on how do you navigate the healthcare system as a marginalized immigrant who's probably not insured, not in the ICE incarceration system. Carla, did you speak to her? Because I know she also wanted somebody that was middle country, like South Dakota, because she didn't want to do, there's a heavy bias of California for many other works.
Yeah, no, we had a good conversation, and we did talk a lot about the geographic disadvantage that South Dakota has, especially when like disseminating information and working with immigrant populations in rural communities. So we talked a lot about the lack of infrastructure in regards to healthcare in rural communities, and what that means for immigrants who work in the agricultural sector and in like small towns where everybody knows each other, like how difficult it might be for stories like this to get out there, but also having such a small population can become a barrier to accessing healthcare.
Good. And do you think, I guess maybe a follow-up question is, do you think the conversation with her will continue?
Could you repeat the last part?
So my understanding was she wanted to actually, the concept was a 4-part series in National Geographic with 4 different stories of 4 different immigrants. Do you think she will come out there to potentially interview one of your beneficiaries?
Yeah, we put her in contact with a community member that we work a lot with, and who we worked with before we got this grant, when we had an emergency relief fund, and then during this grant as well. So we haven't had any updates since or like heard anything back since the conversation we had with her last Friday. But hopefully the contact that I put her with was able to fulfill that part of the story.
Great. Yeah, and that's actually, it's a really good point you mentioned about the direct cash, because when she came through the California Immigrant Resilience Fund, which I know many of the organizations were part of here that were in California, which was a similar direct cash distribution. So she is very much aware that the Vaccine Equity Coalition, in a sense, is a child of the California Immigrant Resilience Fund, that they were the ones that helped us. The California Immigrant Resilience Fund created a lot of the connections here of that coalition, and then it helped really with the funding aspect, because there was a trust. Oh, these organizations have worked together before, they're effective. And so that tie is probably pretty strong in her mind. So anything for anyone else that has been introduced to Priyanka or would like to have their story featured, I will do whatever I can to help elevate that. And I would ask that everyone does the same, because most likely the story will be about people. And we should all do our best part to advocate for their stories, irrespective of if it's CCIJ, Freedom for Immigrants, South Dakota Voices for Peace, whatever the organization is whose stories are featured. We should all do our part to be able to share and celebrate that, because it is a common plight that we're trying to serve. But fingers crossed that this article will come to fruition. And it seems highly likely. The last I heard was a week and a half ago. I'm trying to get budgets ready to travel to do interviews. It seemed like a really good go. Any other questions on that before we move from individual stories to collective impact? So, impact. We are still a very determined and active coalition, not so much as in its peak, but on a weekly basis, we're vaccinating on average 380 people, reaching close to 9,000, and testing about 314 people per week. Again, as a coalition, some people are very much focused, like Global Resource Management, GRM, on testing. Some are able to do vaccinations on site. That vaccination number is actually an average per week of people that do vaccinations on site, or they committed via a text, or Kiwa does this with like, show me your vaccination card that you actually did get vaccinated. You have proof. There is still an ongoing impact. I will say it's not as high as it was in the November during the Omicron. It's about roughly half, meaning that during the Omicron crisis, if we call it that, November through January, we were vaccinating close to 650 people and informing about double that amount of people. So we are still very active, not as active as during the Omicron crisis, and potentially probably through spring and summer, where most likely trend-wise, the vaccination or the infection rate should stay low. We'll see how other variants move, especially as we're releasing the safeguards, which leads me to my next question is, we have this opportunity to actually dig a little deeper into what the population we serve, what they are afraid about, what their habits are in this new, my personal thing, I call it quasi-safe. I feel safer, and I want it to be safer. In the back of my mind, I'm still hesitant. So first, the plan for the survey, and then the questions. The plan is we'd really like to lock down the questions by end of this week. We are going to review the questions that we have ready. Thank you for everyone that committed or submitted some ideas, and also all the open dialogue we had last month. We will create the survey in English and Spanish. It'll be mobile friendly, so you can text it, you can take it on site. We'll talk about individual orgs that can help share it. We ourselves will share it with certain immigrants that we serve. Essentially, that will be done by end of next week. Like before, for the previous survey, we can make it in any language. All we just need help with is the translations. So ideally, by end of next week, the request is that all translations would be submitted, so we can then start collecting over the month of May and have a report ready by June. That is a critical time too, because the initial round of funding of this coalition goes through end of August. And depending on the responses and the survey, which could be very well considered, at least in my mind with my fundraising hat, as a needs-based assessment, it's a critical timing of saying, are we going to continue this coalition? Do we start moving towards mission accomplished? What is society like? It's going to be a whirlwind, especially as more and more safeguards keep going down. That's the rough timeline. So let's take a look at the questions. This is meant to be an open dialogue. I'm going to be careful here because we spent a lot of time getting these questions here. Already some feedback. We don't want to make it too open, but we also want to make sure it's effective. So I'm just going to read through them. I talked about a little bit of the background. And if there is a question about the wording, especially for many people here are multilingual, think about how you translate this into your own language. That sometimes helps to make sure the way you ask the question very much has an impact on the response you receive. And is there anything missing? The goal last time and the goal this time is to have it take 3 to 4 minutes for somebody, whether they get it on text. I know people that are still doing on-site vaccinations. There's a 15-minute window where a person may be unoccupied and could get an iPad or even just a volunteer helping them to be able to fill it out. Again, this will, just like last time, it'll be a link to the form that's mobile friendly. It'll fit on a phone, it'll fit on a tablet, it'll fit on a laptop. There's lots of ways to do the intake to make it as easy as possible. Same goal as last time, get about 500 respondents. So all that said, here are the questions. We have 9, fits in roughly with our 3-minute mark, since about half are yes, no. So a big focus of the vaccinations that we had heard about from a lot of partners with pediatrics, hence the 5 years or older, defining children. Do you feel your children are safe getting the vaccine? And is Karen on the call? I think I saw Karen. Karen, are you there?
Yes, I'm right here.
Okay, you had a good call out. The original version of question 2 was a little awkward, so we made it very similar to the first one. There is no question anywhere else on this survey about vaccine access. This was our one opportunity to ask about pediatrics, and in a slight way asking about access, which is, do you feel your children, 5 years or older, can get access to the vaccine? Does that sound better in your mind? Because I don't want to read the previous version, but we agreed it was awkward.
I think it sounds better for sure. Thank you.
Okay. Do you feel it's important to get your booster? Yes or no? And any time, by the way, pause me or interrupt saying, I don't know about that. This is meant to be open. I'm just going to keep reading unless I hear, or if you want to put in the chat any of your thoughts, please do. Are you required to wear a mask in the workplace? This is going to be fascinating. This is one of my, I'm really curious about this question.
Hi, Bart. I just wanted to pop in real quick and ask about framing feelings, and if our goal is to frame it in a way where they feel okay to give an opinion. Because if you ask me, do you feel your children are safe versus are your children safe getting the vaccine? Does that make much of a difference? Because we asked, do you feel 3 times?
Yeah, and it's a good point, because the sequence of that, I think safety is a feeling. So I'm confident in that one. The second one, I'm hesitating a little bit. We did change the wording, because the original wording, which Karen pointed out was a little awkward, was more about access, which isn't necessarily a feeling per se. It's
can it just be, can your children get access to the vaccine? Are your children able to get access to the vaccine? Like that kind of a question.
Yeah, I think we need to remove the feeling. We don't need to wordsmith it. You said it perfectly, and I couldn't quite grasp it.
Oh, Janice said, are your children able to get the vaccine easily?
My one thought around access is I just wondered if people might have different thoughts about what having access to the vaccine means, because it seems like what we're wanting to know is like, do you think your kids could go somewhere and get the vaccine if they wanted to, / if you wanted them to? I'm not sure what others think, though. That's just kind of what I was.
Let's do this really quick. It's a great call out. We did ask questions last time. Do you feel that the vaccine is safe? That was the final question on safety, which is very similar to number 1. That correlates well here. I'm trying to see if we have any access questions. You have access to information about the vaccine. And I guess we had more about, do you believe the vaccine benefits you personally? That's a little different. The only question that I have about number 2 is the adverb easy. What does easy mean? I like April.
Yeah, that leaves it too much up to interpretation, because then they could say yes or no, depending on whether or not they think it was easy based on their site, their clinic, or whatnot.
New one, we'll define, and I think we went back and forth a little bit just for everyone's awareness on defining children, because I'm a parent myself. My first child, who's 2, cannot get the vaccine. So hence we wanted to put 5 or older, just to make sure people are aware that that is still the baseline. I like this one. Can your children get access to the vaccine if needed? Why if needed? If needed does correlate to access. I got another like that from Janice on number 2.
But if needed,
it makes
eligibility, just in case, or can
Yeah,
your children get access to the vaccine if they are eligible?
If you're 4-year-old, you still
What
need
about
it. Like it's not spelling out that 4-year-olds don't qualify.
Right, I think it would, and that's why we wanted to include this, and this would be included here. This is essentially the only chance on this entire survey we get about access,
Right. Okay.
which we think should be pretty high. That would be my working assumption. At this point, we have
I think that the issue is that this question doesn't let us distinguish the answers from no because my child isn't 5 and no because I can't get the vaccine.
right, which April, you should probably be, I don't know if I'm going to do this as a new one because April's account's new version. And thank you so much for helping with this. If they're eligible, 5 years older, can your children get access to the vaccine? That should remove the risk.
Right.
Alexander wisely called out.
Well, now the way that the question above reads is fine. It says, can your children 5 years or older get access to the vaccine if needed? That's just, so that takes care of it. But we don't have to say if they're eligible and 5 years older.
But the if needed, I mean, I initially suggested that, but that seems vague.
Yeah, if you're looking,
who's
that
determining if they don't think that things are important, then they're gonna think they're not needed across the board. So I revised to eliminate that.
So we can just say, can your children 5 years old or older get access to the vaccine?
Yeah, okay, I can see that. So we're basically saying this one.
The other way around.
The other way around?
Oh, sorry. If they're eligible. We're saying the other way around.
Get rid of the, just get rid of the if needed.
Take the word is needed out of the one, yeah.
And someone else had a comment about having an NA option.
I think that
if you don't have any kids.
Yeah, I saw that. Thank you, Robert. Yeah, is not applicable for both. Okay. Hopefully we won't run out of time. Are you required to wear a mask in the workplace? Are you wearing a mask in public places? Always, sometimes, rarely, never. Do you have access to testing kits when you want to test for COVID? And if you test positive for COVID-19, how many days do you take off of work? I wanted to pause on these two really quickly, and then we can look at the last.
Just reflecting on the NA. Sorry, go ahead.
No, the NA was earlier, so go ahead, Posey.
Well, I'm just saying, if you don't work, how do you answer this question? So there's also an NA needed for something like this. If you test positive for 19, and if you don't work, you need an answer for this.
Is NA?
Yeah.
Maybe how many days do you isolate or quarantine instead of how many days do you take off work?
That's a much inclusive way.
Yes, I like that.
Yeah, I think that addresses my concern, which was maybe a follow-up question or a prior question of, do you work from home or with others?
Right, so you
but I think the quarantine or isolate does take care of that.
Yeah. Great idea.
Yeah, that's much more broad and good, great call out. The next one related to testing, do you or members of your house, anyway.
This is Andrea. I wanted to make a comment about number 7. It's more towards number 7 and also number 3. So the question, if people feel that it's important to get a booster, we've heard folks that would like to get the booster or are interested in getting vaccinated. The issue we run into most of the time is when folks want to, they're concerned about the side effects. And the biggest issue is they don't get paid sick leave, right? Even though we know that it's required in the state of California, many employers don't respect that. And so many of the times when we have conversations, people will say, well, I want to get vaccinated, but I'm afraid that I might get side effects and I won't be able to take the time off. So I wanted just to raise that, because even if folks would understand the importance or want to, there's still a lot of other barriers that are not allowing folks to do it.
What other barriers? That's a great call out. So I think that's an entirely new question. But what other barriers have people heard? And we don't need to work with it to run out of time.
So retaliation for taking time off, not being able to take the time off, not having financial security. So if they do take the time off, they miss a day of work or days of work, they won't be compensated for that time.
Do you have people, and this is open to all, do you have people looking for specific brands of vaccine and they can't find that brand and they won't take it unless it's that brand?
Yes.
And I will add also the general distrust to the booster, right? I'll tell you, I know people who had the 3 vaccines already, but they're like, do I really require another one? And they're like, I better wait until, I'll wait until everybody else responds to this. So
don't want to be the first one to do it. You want to
right, exactly.
Yeah, I could hear that. I heard like it's almost lower efficacy of like it's like, and we won't be able to wordsmith this perfectly, but I heard this as distrust of booster impact. Is that even close?
It's like, I've had enough, I don't need it, or
there's also some suspicion of the profit motives, like maybe people believe in the necessity for the vaccine, but then it's like, wait, every 6 months they're making us get another one. Not that it's being, charged for currently, but I think there is that skepticism or cynicism also.
So we're also working on the booster number 4 clinics as well. So there's a difference between what people are thinking, getting their first booster versus their second, or the 4th shot, I mean. So the first booster versus the second booster.
So when you say boosted, is it the second one or the 4th one?
Yeah, so fully vaccinated is the first 2 shots, and then the 3rd jab is the first booster, and then the 4th jab is the second booster for 50 and up. Yeah,
but I would still keep it as boosted here to make it more inclusive. Plus we can compare, because there is a lot of data on they just call it boosted. From Kaiser does a lot of research and they just call it boosted.
It's just maybe we just say 3rd shot and on, right? So not first 2 shots.
I would disagree, because then we can't compare it to any existing data, whether it's CDC or Kaiser Permanente's foundation, like they all call it boosted.
Okay. 3rd question, is it important and safe? Do you feel it's important to get boosted?
That is a really good call out, and then because I know we are at time, but just on this last point, do you feel it's important to get your booster or safe? I think we can.
I think I've seen more hesitancy around importance. There are people who are vaccinated and not feeling urgency to get a booster.
Right.
Not that they're concerned about the safety as much as it's just not a priority. Like
agreed. And I think we will take time after this call. We'll circulate this again just to make sure it's locked down. But I think we can address safety. It's a great call out, Robert, but I think we can address it in number 10.
Can I get back to number 10's answer and create side effects as a different answer than requiring time off? Because some people just about side effects.
Yeah, I meant, I think that will need to be split up. I agree with that. And then many thanks to Karen for this suggestion. My biggest worry in contracting COVID is financial stability, my health, exposing others' mental health. Is there any other option anyone else can think of?
Long-term, like a long COVID? Like rather than acute?
All right, can we change that word from contracting to catching?
Love it.
And we'll make it very aligned.
Also, I'm sorry, can we jump back to 5 for a second and say, are you wearing a mask in indoor public places? Because we don't need to wear it outdoors in the vast majority of circumstances.
Yeah, when Melody and I, we rewrote that question. I remember we went back and forth on that, just in terms of brevity versus is it axiomatic or obvious that it's, but we can add it. And I remember it was in there in an earlier version, actually. It doesn't, I think, it doesn't make it any.
Yeah, I just think about how I would answer that question. And if it didn't say indoor, I would say sometimes.
Right. Good call. Yeah, we went back and forth on that one. All right, we got another.
The art of creating a good survey. Thank you.
Especially crowdsourced, which was, I know this was a risky endeavor because everyone has, especially when we think about, we are almost all immigrants on this call. I know I'm thinking about this in a couple of different languages. It's like, it's very challenging to do it. So I appreciate also all the extra time you're spending for those.
Bart, did you have a chance to go through all the numbers that you wanted to go through to?
Bart just needs to make sure I'm not running late for a meeting. No. Okay. Sorry, could you repeat again?
Did you get through all the materials you needed to get through for this meeting?
Yes. We're good here. And anyone that needs to run, please do. Thank you very much for the time. If anybody's willing to stay, we may as well. Actually, I think I'm going to stay, Posey, if you can, and anyone else is welcome to. I'm going to stop the recording and say thank you.
Thank you.
All the time. I'm going to stop share, and then we're going to finalize for anyone that can stay. Be well, stay safe, stay strong.
Stay safe, please.